And these fibroids, they develop in the uterus of a woman. And it is estimated that about 70 to 80% of women will develop fibroids in a lifetime. However, it's not everybody that develop fibroids that needed treatment, because at times these fibroids are so small that they are so insignificant. But no matter how small they are, we all know things change per time. We should never, never overlook them. So now, what is a tumor? A tumor is a swelling of a part of the body, generally without inflammation, causing an abnormal growth of tissue, whether benign or malignant. That is, it may be cancerous and it may not be cancerous. So because there is a tumor does not mean there is a cancer. And tumors occur when cells divide and they grow excessively beyond what they are supposed to be in the body. So when we have cells that are damaged like that and they're not needed, they die to make room for healthy replacement. So, but when these cells are growing rapidly beyond what they are supposed to be, then we say it is a tumor. The fibrous connective tissue, these are tissues that provide support and shock absorption. When you in a car, you said a car has shock absorber. And when this car enters into a gallop, it just bounces back to its normal self and it does not have any effect on it. So the same way the body has shock absorber, that in case anything happens, there is always something to absorb the effect so that it does not affect you or the organs of your body. So these shock absorbers, they are called fibrous connective tissue. And this is one of the major things that is being damaged when there is a fibroid. So there are three major types of fibroid in the body of a person. So we have intramural fibroids, subsistoral fibroids, and also we have, excuse me please, let me just do this. And also we have the submucosal fibroids. All these, they are fibroids
Apologies, looks like we have lost pharmacist Wuraola. She's going to come back on. I believe this is network issues where she's at. Okay, we've lost her completely now. I believe she's going to come back on. Apologies about that. Some of the things we have to deal with in Nigeria. So let's just wait. Please bear with us for a bit. Apologies, our speaker has been logged out. I believe it's network issues. We're just waiting for her to come back on. Sorry. Good evening to everyone that is just joining us. We are waiting for our speaker to log back on. We lost her. I believe it's because of network issues. Please bear with us. She's joining from Nigeria. I think that's what happened. Let's just wait. Apologies, guys. She's going to join us in a bit, hopefully. Thank you so much. Madam Wuraola, please raise your hand if you're back. Oh, yes. Okay. I can see you now. All right, please come back on.
Okay. I don't know, it's the network. The whole thing just went off. Yeah. So let me upload the, take it back. So I was trying to show us the picture of the uterus and to show us where this fibroids could be located. And that is what gave them their names. I believe that was where I went off the other time. So this is the fundal fibroid. It's also called a fundal subserosa. You can see that it's very, very big. And most of the time, the big ones are always located on the fundal part of the uterus. And also we have, if you see this one, I believe you are seeing the arrow. This is
go ahead, ma.
Okay, this is the pendulum, like a pendulum hanging fibroid. We have the ones that are hanging like this, and this is another one, here is another one, and here is another one. So that just gives us a little view of how they look like in the body. So now, the uterine fibroids, these are the most common because most women that have fibroids, they have it in their uterus, right inside. They're the most common in women, and many women have these fibroids. And in fact, we can even say virtually every woman has a fibroid. It's just that some of them are just so insignificant that there is no need to panic about them. So fibroids may be discovered incidentally. That is, you might have fibroid and you won't even know you have it. So it might be when you go for probably a pelvic examination, or maybe you want to give birth to babies, or you want to get pregnant and they're trying to check your womb to be sure everything is okay. So for most people, they just discover it accidentally. So uterine fibroids are non-cancerous, though fibroids can eventually be cancerous in some cases, but generally fibroids are non-cancerous. Now, uterine fibroids, they are not associated with increased risk of uterine cancer, like I've been saying, and they range in sizes from seedlings even to as big and bulky as a baby. Because you must have heard of some people saying that they brought out the fibroid and it's as if it's a baby. And you see some people that had fibroid and you see their tummy so big that you will actually think they are pregnant. So you can have a single fibroid, and it's also very possible to have multiple fibroids, because you will hear testimonials from a lot of people that will tell you that they brought out a lot of fibroids from their tummy. In extreme cases, multiple fibroids can expand the uterus so much that you think the person is pregnant, and it has heavy weight. and the person will feel so heavy that they cannot carry their body. So now, what is the cause? If we know the cause, what causes fibroid? Amazingly, we don't know the cause. We don't know the cause. And researchers are working all the time trying to discover what could be the cause of fibroid. But they came up with some points, but we cannot 100% say this is the cause. Now, one of the things they came up with is that genetic changes. When there is genetic changes in the body of a person, the genes mutilating and changing, then a fibroid can come on. Also, hormones, hormonal imbalance, and this happens a lot with women, especially with estrogen and progesterone. These two hormones, they are the ones that stimulate the development of the uterine lining during each menstrual cycle. And at times, their presence may create a problem. They prepare your body for pregnancy, and as well, they appear to promote fibroids. The same hormone that helps you to get pregnant may eventually promote fibroids. So fibroids contains more of estrogen and progesterone receptors than typical uterus muscle cells do. And they tend to shrink after menopause. Fibroids tend to shrink after menopause, but that would mean such a person is actually taking good care of that body. Other growth factors also can cause fibroid, like substances that help the body to maintain tissues, such as insulin-like growth. They can cause fibroids. Now, let's look at some of the symptoms. Let's look at symptoms. Now, some symptoms that a person that has fibroid may have include discomfort in the lower abdomen. You know, when you start feeling uncomfortable in your lower abdomen, then you can suspect. That does not mean you have fibroid anyway, because there are several things that can give you discomfort in the lower abdomen. It could be a vaginal infection, it could be several other things. But fibroid will be one of the things that will be queried when you have such. And also when you have constipation constantly, you always get constipated all the time. When you go to the hospital, one of the things that will be queried is fibroid. And back pain, consistent back pain. I know, you know, most people, when they have back pain, they take it to be probably hemorrhoids, or they call it jedi. And most of the time I tell them, because you have a back pain does not mean you have jedi. It might not be hemorrhoid. It could be some other underlying diseases and infection that you don't know about. And also, when you have pain, labor problems, people that have labor problems, anytime they want to give birth, it's very possible there is a fibroid hiding somewhere in that uterus. And also people that have pregnancy problem, they couldn't get pregnant, or they are having miscarriages, which is one of the points listed. Fertility problems also are part of things that symptoms that a person that has fibroids will have. And also a fibroid can cause acute pain when it outgrows its blood supply. You know, it can cause so much pain. When you see people that have pain all around the tummy, pains in the tummy should be properly checked, because you wouldn't know it could be a fibroid. And when you have heavy and painful periods, I would say that a lot of people have painful periods. So I'm not saying everybody that has painful period has a fibroid, okay? But when the flow is heavy and you are having painful periods, then it's likely to be a fibroid that is in the uterus that is disturbing such a person. And like I've mentioned before, repeated miscarriages. Now, how do I know if I have fibroid? What type of fibroid do I have? I've told you the symptoms that will help you to actually suspect that you have fibroid, and there will be need to actually do a test to confirm it. So how do I know the type of fibroid that I have? Through one, a test called HSG, and this is called hysterosarcoma. So this test is a type of X-ray that allows you to see into the uterus, and they will be able to know whether there is a fibroid there or not. And also the transvagal ultrasonography, that is the TVUS, is when an ultrasound wand is taken around the tummy inserted into the vagina to see whether there is a fibroid there or not. So it is possible for us to know if you have a fibroid when you do this test, and the type of fibroid you have will also be detected. So let's assume that you are having all of these symptoms that I've mentioned. When do you know that there is need for you to actually check? Because you know, some of those symptoms, they come in once in a while, and it might not be that you have a fibroid. Like I have said, someone like me, I used to have menstrual pain when I was a young girl, so much that I might not even go to class for 3-4 days, but I didn't have fibroid. I hope you understand that. So when do you go for a test? You go for tests when you have one, pelvic pain that doesn't go away. You have pelvic pain and you are using painkillers or you massage and everything, and yet this pain refuses to go, then you know it is time for you to get to the hospital or to go do a test to know what is actually wrong. When you have overly heavy, prolonged, and painful periods, like I've said, you know, most people, their period flow for 3-5 days. But once in a while, we have this strange period flows that goes up to 10 days, 7 days, 10 days, 15 days. I've seen someone that told me that for a whole month, she was menstruating. So in such a case, fibroid will be highly queried, that definitely there must be something wrong with that body. Then spotting or bleeding between periods. This is what that means. Let's assume you see your period every 28 days. Now you've just had a period now, and some few days after, maybe like 4-5 days after, you could see a spot of blood on your panties, and then like a week after, another one. That is what we call spotting. So when it is spotting, then you know definitely there is something wrong somewhere. And also, when you have difficulty in emptying your bladder, you find it difficult to empty your bladder, and that is telling us that there is something wrong. All the time, you always find it difficult to empty your bladder, to urinate. Definitely something is pressing on that bladder that is not allowing you to urinate. So in such a case, there is need to check. And also unexplained low red blood cell count. No, when you do your blood cell count and it's so low and they cannot explain why it is, they will query fibroid as well. Then when you need to seek prompt medical care if you have severe vaginal bleeding or sharp pelvic pains that comes on suddenly. When you have such, you know that there is need for you to check. How do I know I'm at risk? There are few known risk factors for uterine fibroids other than being a woman of reproductive age. So what does that mean? That means that women that are of reproductive age, generally most of them have fibroids. That is between the age of 30, 40, 45, or even some 25. It's very, very possible to have fibroid. And you know, most people that attain menopause are free of fibroid. And one of the risk factors we have is race. Amazingly, Black women have fibroid more than white women. So, but all women of reproductive age could develop a fibroid, but Black women are more prone to fibroids than those from other races. And also hereditary. It could be hereditary. If your mother or your sister or someone in your family had fibroid, it is likely that you will also have fibroid. Now, another other factor or some other factors include starting your period at an early age. You know, some people start periods at a very early age. I once heard of a 9-year-old girl that started her period at age 9 when some of us were still wearing vests. So she started at 9. So early age like that can also be a sign that this person is likely to have a fibroid. And obesity, when you are just too big, it's also a sign. And also vitamin D deficiency. Vitamin D is extremely very good for our body. It works on the bones and cartilages and also helps a lot of areas of our body. So vitamin D is very good, and we get a lot of vitamin D from the sun. And people that are deficient in it are very likely to have a fibroid. Having a diet higher in red meat. We've been talking about this dietary thing for a long time, and you will see that that is where we are still going to round up today on diet. Diet has a big part to play in our lives. So we need to really watch what we eat. We need to watch very well. So people that are having diet higher in red meat and lower in green vegetable fruits and dairy, and people that drink alcohol, including beer, appear to increase their risk of developing a fibroid or many fibroids. So also women are at greater risk for developing fibroids. That means it's very likely that a man may not so, but women are at greater risk of having it. In fact, it's mainly women that we see that have it. Also pregnancy, where pregnancy can also, because you know, I told you of estrogen and progesterone the other time, that the same estrogen and progesterone that help with pregnancy is the same one that feed the fibroid. So it's very possible. And family history, like I've said, age of 30 or older, African Americans, Black people, they are more prone to fibroids than the other people. Now, what are the key points that you and I need to take home today? One, fibroids are most common during the reproductive years. And two, it is unclear exactly why they form. We don't know the cause. We don't know why they form. We don't know how they get there, but they shall appear and they develop when estrogen levels are higher. And most people experience no symptoms at all. There are some people that won't have a symptom at all. All those symptoms I listed, they won't have it. And yet they have fibroids in their body. But they can often have low back pain, you know, constipation, and some other painful, when they want to pass urine, they have pain and all those things that can lead to bleeding and all those things. So, but generally, there are people that do not have symptoms at all. Complications are rare, but they can be serious when they come. Now, let's look at it. Complications, although fibroids usually aren't dangerous, but we've had cases where people have complications, and these complications can be very bad. Let me use it that way. They can be very, very bad because they can lose blood and they might need blood transfusion at times. Now, also pregnancy and fibroids is also part of complication. Imagine a baby growing and a fibroid also growing in the same place. So you can imagine the kind of stress such a woman will be going through. Fibroids usually, they don't interfere with pregnancy, but when the fibroid gets much more bigger than the pregnancy, you know there is definitely going to be a problem. And they may also raise the risk of certain pregnancy complications when they are there. They may raise the risk. Now, let's look at prevention. How can we prevent fibroids? Can we prevent it? Now, researchers, although they continue to do these studies, since we don't know the cause. When you know the cause of a thing, you can say, okay, A is causing this thing, then let's remove A. Once we remove A, we won't have that problem again. But when you don't even know the cause, what do you do? So we discovered some few things that can help. Few things. So now we have having good immune system. Having good immune system. Your immune system, I call them the soldiers of the body. They are the soldiers of the body. They guard your body. They protect your body. And they are the one that rejuvenate your body. They are the one that help to solve problems that your body may have. Any kind of problem your body may have, they take good care of it. So the immune system is extremely important to be in good condition, not just for fibroid case, but for any case at all that you can imagine. And when your immune system is well boosted, you discover that diseases do not come near your dwelling. Now, maintaining a healthy weight, we need to maintain a healthy weight. You had BRD saying the other time that we are partners when it comes to doing this jogging and exercise in the morning. We do like 30 to 40 minutes most morning, Monday to Friday. You can also join us. It's very, very good. Please take your time to do exercise. Take your time to walk. That is one thing I am trying to do because of my work schedule. But very, very soon, I am going to create time for that. You need to walk. Take a walk for like 30, 40 days. And from what I had, you need to take like 10,000 steps per day for you to be in good shape. So exercising helps a lot, helps fibroid health a lot. Now, eating, what you eat matters. You need to be eating fruits and vegetables and take a lot of them. You may be able to decrease your risk factor of having a fibroid if you are the type that take fruits a lot. So you may, and when you take fruits a lot like that, even when you have them, they are like, should I use the word redundant? They are like redundant. They're just there and they're not having any harm on your body. So also, some researchers also suggest that using hormonal contraceptives, a lot of us women, especially when you are in that childbearing age, you have to keep yourself in order to keep your home. So you use a lot of contraceptives, and they may also lower the risk of fibroids. Not all of them, some of them. We are not going to mention names here. Thank you. Don't ask me for the name of anyone. Okay, let's go on. Now, treatment. How do we treat fibroid? Now, after examination, I told you the other time that there might be need to do some tests. You might need to do scan and everything to check to be sure that there is a fibroid there. So as to know the extent of, I don't want to use the word damage, there's still a damage that is there. And also to know the quantity of the fibroids, that is there. Like I told you, it could be a single fibroid and it could be multiple. And they can be as small as seedlings and they can be as big as a baby. So after examination, for treatment depends on three major things. One, the person's age. They have to consider the age of the person, maybe whether this person still wants to give birth to children. All those things will be considered. And then the size of the fibroid will be considered, and also the person's overall health will be considered. And we also want to know whether this person already have children or this person doesn't have children. If the person already have children and the fibroid is so much, then the womb may be removed just to keep that person alive and still be here. Now, combination of treatments are usually taken for in orthodox. So we have combination of treatments, several drugs can be given. I don't want to go into that area at all. And in some cases, surgery may be advised. Surgery may be advised, but there is need to do surgery in order to remove them, depending on how they are. But also we can have home remedies and natural treatments. We can have home remedies and natural treatments. And certain home remedies can help us. Let's look at some of them. Massaging. I told you of having back pain and lower abdominal pain could be there. And you find out that when you massage those places most of the time, you will have a good relief. And I've heard of people saying that when they take alcohol, but we need to be very careful. Alcohol has a limit that the body can absorb. And if you remember, when we were having kidney health, and we talked about how alcohol can affect the kidney, and also alcohol can cause a lot of danger for the body. So massaging can help a lot. It will help to reduce the pain and help the person to relax. Also, applying heat. When you apply it for cramps, it also helps a lot. You can actually get a hot water bottle. I believe you know what a hot water bottle is. So when you put hot water inside it, either you have the one that you have to put the hot water inside, or you have the electrical one that you have to plug and it will get warm, and you can just put it on the painful places. That can calm you down, but that does not remove the fibroid. It can calm you down, make you feel comfortable at that time. Now, applying heat, I've talked about applying heat and I talk about hot water bottle. So also dietary changes can help. This diet is here again. I've discovered that there is nothing, no ailment, no disease we can talk about without diet coming to play a major part in it. Now, dietary supplements can help us a lot, and we need to avoid meat and high calorie food. When a person has fibroid, they should avoid red meat. Even if you don't have fibroid, I mean, now you need to know that red meat is actually not the best for us. So we need to avoid red meat, and high calorie foods are not so good for us. But instead of that, let's go for food high in flavonoids, like seeds. It's good. Seeds are nuts, take a lot of them. Green vegetables, and green tea is also a very good one. Cold water fish, such as tuna or salmon, are also very, very good for our body, and they will help with our fibroid health a lot. I'm still going to come back to talk more about diet. Managing your stress level is extremely important. You need to manage your stress level. And like I used to tell people, what is that thing that gives you stress? Please today take a paper and a biro and write it out. When you write it out, then sort it out. Write it out and sort it out. Whatever it is that is giving you stress. If it's family, please sort it out. Because when you are stressed, your immune system is affected. It comes down low. And before you know it, a lot of diseases and infections will come in. So you need to be very, very careful with that. Managing your stress level is extremely important in fibrous cases, because when you are stressed, you tend to lose more blood. You know, when you're hungry, you are stressed. If you are very sensitive, you will notice that when you are stressed, or maybe you get angry, you shout and all those things, and that week is a week of your period is to come that week, you will have a very heavy flow that week. Just watch it from now. If you don't, if maybe you've never noticed it before, but you watch it, you will discover that. So managing your stress, I'm saying it again, managing your stress is extremely, very, very important. Now, weight, when you are overweight is also something that you really, really need to watch. So let's watch our weight and what you eat. You know, I tell people this, you can be big and you may not be too heavy. Let me put it like that, because bigness has to do with your bones. There are some people that have big bones, so they cannot be slim. It's not possible. They can't be slim because of their bone type. So, but that bone type does not mean you should now be obese. Obesity is a very, very dangerous thing for fibroid health. So now let's look at dietary supplements and fibroids. Okay, a healthy diet that's low in calorie, sodium, processed meat, but high in flavonoids, seeds, and green vegetables, green tea, and cold water, fish such as tuna and salmon will be of tremendous help when there is a fibroid. I've mentioned that before, but there is need for me to mention it here again. So you need to focus on eating well, eat well, eat good food, okay? And well-grown plant seeds, leaves, such as kale, dandelion, black cumin seed, and many others that we all know. Grapes are also extremely very good for good health, for your body. So all these things will help you. And also, okay, before I go into this, because dietary supplements and good diet is one major thing that helps. We have seen several cases, we've seen several people that they did not do surgery, and yes, their fibroids are gone today. Some of them had surgery and the fibroids grew back again, came back again, because all these things, they are free radicals in the body that cause them. When you have a lot of toxins in your body and free radicals in your body, there might be issues, and fibroids may grow from those places. You know, we are not so sure of what is causing it. But if we can just take good care of our body, if we can just remove anything that might cause a problem for the body, then we are sure that fibroid will not come. For me, from all this research work, what I would say is that when you are not taking good care of your body system, especially for a woman, you know, we have very, very sensitive body, even up to our skin. Your skin health is extremely important. What do you rub on your skin? What do you eat? Your vagina, your reproductive parts, how are you taking care of it? Your undies, how are you taking care of it? From these little things, we get a lot of free radicals and toxins coming into our body. I know a lot of women that can wear one bra continuously for 1 month. Please, even if it is one that you can afford, wash it every night. Wash it in the night and hang it where it will dry. And if you can just struggle to get two, in case you want to tell me that you don't have money to buy it, but I don't see any reason why every woman should not have a lot of undies. All your lingerie, you should have a lot of them. Bra, panties, and everything, you should have a lot of it, so that you can always change them as often as needed. As often as needed. And I advise ladies on one thing: once you remove a pant, once you remove it, please don't wear it again without washing it. I've seen people that will remove it today and tomorrow morning they pick it up and they wear it again. Don't wear it again. Always make sure that you wash it very, very well. So now, before I go on, because I would like to tell you about a company called Rain International, and that is our company. We are Rain International is a health and wellness company, and it is based in Utah in the United States. And in conjunction with scientists from the University of Maryland and John Hopkins University, they created supplements with seeds, and they made them available in 46 countries. And these supplements and seeds have been doing great work in the life of so many people. So before I tell you more about these seeds and supplements, I would like I have two people that have used supplements to take care of to first of all call on Mrs. Akinwale. I don't know if you're there, ma. Mrs. Oludoyin Akinwale, are you on? I would like her to share a testimonial with us.
Mrs. Akinwale, if you're on,
is Mrs. Akinwale there?
I'm looking for her. If she's on, please raise your hand so we can unmute you. I can't see her. Let's see. Okay, I can't see.
Okay, maybe.
Is there anybody?
I have another person.
Oh, you have somebody else. Okay.
Yes, Mrs. Ogungbaidi. I hope I pronounced that right. Ogungbaidi. Yeah, I think that should be right. Okay. Is Mrs. Ogungbaidi there?
If you're on, please raise your hand so we can find you and we can unmute you.
Wow.
Mrs. Ogungbaidi.
Is that one, ma?
Oh, Mrs. Akinwale is here.
Okay.
I can see her. Mrs. Akinwale, I'm unmuting you now. Hello, Mrs. Akinwale. Please unmute yourself, or rather, I'm allowing you to unmute. I know she's Mrs. Akinwale. Oh, okay. Let me see if I can. Hello, ma'am.
Okay. Mrs. Ogungbaidi has raised her hand already.
All right. Okay. Let's find her.
She has raised her hand.
Oh, okay. Great. Mrs. Ogungbaidi, kindly unmute yourself. Okay, Ms. Akinwale has raised her hand as well. Mrs. Ogungbaidi, please unmute yourself. Or Mrs. Akinwale, okay, Ms. Ogungbaidi, go for it.
Good evening, Rain Nation.
Good evening, ma'am. Good evening. Thank you so much for coming on. Yes, ma'am. Thank you for coming on today. We would love to hear your experience with fibroids and how the Rain products were able to help you.
Okay, thank you, ma. In 2020, I was just feeling this abdominal pain. It was so intense from January that whenever, even if I want to bath, when I bend down like this, to stand up is the problem. And I had 2 tons. I've never even experienced this kind of pain before. So my husband said I should go to the hospital. I said I will go. I was using pain relief. Now in May, early May, I now went to the hospital. I did series of tests and abdominal scan. And the doctor said, you have fibroid. I said, fibroid. How can? So I said, how can I have fibroids? I just said, okay, no problem. So he now said, you have multiple fibroids. You will come for operation. I said, operation. I said, okay, let me go home first. I will get back to you. But Mrs. Ezebune.
Excuse me, but were you given any medication?
Yes, the medication that I was given was for this.
To relieve the pain.
To relieve the pain. Then I had, it was there, I was told that I had this infection, urinary tract infection.
Urinary tract infection?
Because I do have discharge.
Okay.
So I used this thing, the thing came back again. Now, when I now got home, I told my husband, he now said, I should go. I said, me, I can't go for any operation because I have friends that have done it twice safe. The thing the fibroid will come back again to grow.
To come back again.
So now Mrs. Ezebune has been sending these broadcast messages to me for some time. It was around that time I read one on fibroid and I said, so this supplement she used to talk about can take care of fibroid. So I now called her and she now put me on presentation. Okay. So it was after the presentation that I now decided to be a partner. And I bought Raincore and Rain Soap. So after using it for the first night, the day I collected the product, that night, I used Raincore in the night. In the morning, because before I used to be very wet. But when I woke up in the morning, everything was dry. I said, wow, this thing works. Just a night. And then when I continue using the product, my tummy that was big before, the thing came down. And the abdominal pain, it is just nowadays, just once in a while, maybe once in 3 months, I would just feel, not like before, I would just feel the pain a little bit because I'm still using the product. It's just like, it's not like, yes, I do use it, but not often like the time I had the infection. So the supplement works. I've been telling people about this and I will still continue to tell people about this supplement. Thank you for allowing me to share my testimony.
Thank you so much for sharing your testimony, Ma. Thank you so much. I think you can, from what she has said, you can see some of the things I have said. She said it started like she was having this pain, back pain, and that's where most of it normally starts. People will just be having back pain, and you take it as a small thing. Menstrual pain, you take it as a small thing. If they are not well checked when you have such things, it could be any other thing. And most of the time, the medications you'll be given is to treat the symptoms. That's the medications that you'll be given. None of the medications can actually shrink. Yes, we have some medications that are antioxidants, but they are not as effective as you using the natural one. So medications are good. We are not saying medications are not good. But when you try these supplements, you'll be shocked at what you get. You had her say that she used only one, just one pouch of rain product overnight, and by the time she wake up in the morning, she could see a big difference. She had dryness. The discharge that used to come was not coming, and that is one thing I think I'm not sure if I mentioned that a lot of people that have fibroid in them, most of them generally have urinary tract infection. I'm not talking of, UTI, urinary tract infection, is different from STD. They are two different, but urinary tract infection, most people that have it so much, they actually have fibroid in them, and there is need to check that very, very well. Once again, Ma, thank you so much. We appreciate you. So I believe Mrs. Akinwale is now ready. Can we have you, ma'am? Hello, ma. Mrs. Akinwale?
Sorry, she was here a minute ago and now unmuted.
Yes.
If her
was.
thing has gone again, just hold on a minute, because I think no, she's not on. I think she's gone off. All right, let's get this. I've got two people that have raised their hands. I don't know if you have testimonials as well.
Let's find out.
Well, now there are three people. I don't know if you have testimonials. Let me see. Agatha Grace, I'm going to ask you to unmute. If you have, do you have a testimonial, Agatha Grace? Please unmute yourself. Do you have a testimonial on fibroids? Okay, Agatha Grace is not answering me. All right, Sandra Patrick.
Sandra Patrick.
Yeah, I can see that. Sandra Patrick, please unmute yourself. Do you have a testimonial on fibroids?
Not a testimony per se. I just wanted to ask some questions.
All right, we'll do questions afterwards. Not yet.
Okay. All right.
Thank you. All right. Agatha Grace, do you have a testimonial?
Then we have Mercy.
Okay, Agatha Grace is on.
Agatha Grace, yes, ma. Good evening, ma. Good
evening.
Do you have a testimonial of fibroids? Okay, that's not working. Juliana, I don't know if this is the same as Akinwale, but I have a Juliana raising her hand. Juliana?
Yes.
I think she's the one.
Okay. Oh yeah, we've been waiting for
the network is frustrating me. I'm sorry.
I know.
Yeah, sorry.
Go ahead, ma.
Good evening, everyone.
Good evening, ma'am.
My name is Wuraola Olugbenga, and I'm calling from Nigeria. So in 2018, are you hearing me?
Yes, we are.
Go ahead.
Okay. In 2018, I think it was June, I was having severe pain, like our sister that did presentation. In fact, it's awesome job. She did it's like she was talking about me, because I went through so many things she talked about this evening. I was having severe pain under my abdomen, and I was bleeding excessively. Every day, no one day off. And I don't know what it was. And I was just praying. I don't know what to do. The month of June went by, July came, the same thing going on and on. So I have to call my husband that this is what I'm going through. And he told me to go to the hospital. I went to the hospital, I think it was in August. And they did series of tests. They couldn't find anything that can cause bleeding every day, no one day off. So the last thing they did was to do sonogram. Sonogram now let them know that I had fibroid inside my uterus. And it's not this large one, it was multiple one. So it was multiple all over my uterus. And they say, even if I want to have surgery, they will have to remove my uterus. So I said, okay, I should tell my husband what is going on. And we discussed about it. He told me, you are coming to Nigeria, we meet with Alagbos. I'm not pleased with that. So the next thing was, I was just praying, like, God, I want to come out of this. I don't know where it came from, and I don't want it anymore. I'm too young for this. And so the doctor was even scaring me the most. Like, the way you are bleeding, you may become anemic, you may become this and those, and they might give me blood. I was like, I don't want all that. So what next? So she gave me something, maybe it's gonna shrink it, like what they used to not having pregnancy. I don't know what they call it anymore. I forgot that right now. Anyway, she gave me that. I was taking it, and I was bigger than what I used to be. So when I saw that I'm becoming big, before 7 days, I have to stop it. So I cannot continue that anymore. So I stopped it. So I don't know what is. That was August. September came, the same thing going on and on. In maybe September, my sister sent this testimonial to me. I don't want to open it because then I want to stop having network markets, whatever, because I've had them a lot. I think I have had about 10 of them before I get to know Rain. So, and I don't want to open it because I don't want to be involved. So the second time she sent it, I was praying, like maybe meditating, let me call it meditating, like how should I come out of this? And then she sent it again. And then I opened it. The first one I opened was a lady giving testimonial in, I think it was Diamond Lara that was there in interviewing the lady. She was giving testimonial about fibroid. I was like, okay, this look like me. Let me try this thing. But I don't want to be involved. So, but what I did, I was supposed to sign up as a customer. I signed myself up as a business partner. So if it doesn't work for me, I get out. And what I've not used, I forwarded the same messages. I forwarded the same messages, sorry about that, to other people on my phone. And somebody reached out to me and said, are you hearing me? A call was coming here.
Sorry, I can hear you. Go ahead, ma.
Okay. So I forwarded the same messages to other people on my phone. And what happened was a lady reached out to me and said that was what she used when she was sick in summer of 2018. And she got up the same day. I was like, what? Okay. I ordered for basic then. And then I said, okay, let me try. I saw other products on there. So I ordered for other products. And the product came the same day. And I started taking both. First thing I noticed was I was able to sleep. Let me tell you, I work overnight because where I work, because of my children's schedule, I can only work night shift because my husband lives in Nigeria. So I work nights. So when I come, I won't be able to sleep because of the pain. So I was able to sleep. I used one sachet of cough and I was able to sleep. Almost forgot my children in school at 4 p.m. And I woke up rushing to pick them up. I was like, something is working. So I took the other product at night, the second day. So the third day, I called my sister that signed me up, like, okay, sis, this thing I don't think is working for me. She's like, what are you using it for? I was like, oh, okay. They told me I have fibroid and I'm bleeding. Da, 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 da. So she's like, really? Oh, okay. Are you taking it? I said, I'm taking one so one call. And I didn't see different that I want. Actually, what I wanted is I just don't want that bleeding anymore. That's the only thing. I know the pain eventually will go, but the bleeding, I don't want it. So she's like, okay, you might want to do something different. Then she didn't know, she just used initiative. Because she just joined as well. But she used her initiative and told me, maybe you should take like 4 so and 3 core, or 2 core, 3 so, something like that. So the next day, that's what I did. I took 2 core and 3 so. That same day, I don't believe what happened to me. What happened that day was I didn't see a pinch of blood. That first day that I used it that way, 5 sachets, like 2 core and 3 so. So when I did that the first day, the next day I said, let me try it again. So I did the same thing the second day. Same thing happened. So I now have to call her. I said, what I'm expecting, I found it. So to the glory of God, up to today, I'm no more bleeding. My stomach that looked like I'm gonna give birth tomorrow went down totally. Like I was so grateful to God. Actually, that happened in 3 weeks. My stomach started going down. It happened in 3 weeks when I did taking it like 5 sachets a day. So we started sharing that testimony in my environment in Dallas, Texas. And to the glory of God, that helped our markets in that area. So this product is so powerful that I cannot believe what it has done for me. Removing that, though the bleeding came, let me come this way, because I always want to touch that area, because when people use our products, they use one packet, they tell us it's not working. It's because they are not using this the way they should.
The way it's supposed to be used.
Yes, ma'am. Because when the bleeding came back, I was surprised. And then I don't want to share it anymore with my upline. Like, how do I say, okay, what I told her has gone, came back. Listen, everybody that is going through anything, that you have used this product, maybe that thing came back, please keep using it. Why did I say that? I said that because that's what happened to me. I keep taking my products. I do not lose hope, because that's helped me in the first place. And I believe it's going to help me again. So I didn't even realize that when the bleeding came, it was shrinking, because now it was coming black and it was smelling, as in stinking. That if you are still sitting beside me, I might want to move away from you, because I don't know, maybe you are perceiving the odor. So that's how bad it was. And I did that for 2 months. I carried the smelling body like 2 months. That thing was coming out. And when it become 3 months exactly, I want to say it's exactly 3 months, that thing went. I do not hear it. I do not feel it. No more pain, no more bleeding. I'm here today to the glory of God. Thank you for the opportunity, ma.
Thank you so much, ma. Thank you. Thank you so much. We appreciate you so much. You can, from her
Yes,
to, you
ma.
can see a lot of things. The pain and everything. And one thing I want to also pick from her is that odor, the odor. So as a woman, when you observe that your period smells, or when you urinate, it smells, you need to actually check yourself. That might be a fibroid somewhere. The reason why the tummy gets big is because gas, the fibroid, is growing and is bringing gas. So the tummy gets gassed up. And when it is gassed up, that's why it is hard. It becomes hard. And when it is hard, it will definitely an inflammation and give you pain. Thank you once again. Thank you so much, Mrs. Akin.
You're welcome.
Adewale and
Yes,
my other sister. So now, let me go on. So I want to talk about these products that these people used that has helped them a lot. And these products they contain greens. They contain a lot of greens like dandelion, kale, and spirulina, wheatgrass, aloe vera, and the black raspberry, and much more than that. They also contain seeds. And these seeds include the black cumin seed, and we have the milk thistle seed, the cranberry seed, and the chandonari grape seeds. And these are the things that Rain International put together to bring about these two wonderful products called Rainsoul and Raincore. So all those greens and seeds that I've mentioned, they are the ingredients in Rainsoul and Raincore. Now, what is Rainsoul? Rainsoul is our flagship product, and it was created by a team of doctors and scientists who are looking for ways to provide nutrient-dense food for children who have gone through chemotherapy and radiotherapy, because they discovered that these children, after the chemo and radiotherapy, they were, some of them died, and some of them came back even with more cancer cells. So they went into work and they were able to discover these seeds that they used to produce Rainsoul. 4 of them, or 3 major seeds, sorry, and that is the black cumin seed, the black raspberry seed, and the chandonari grape seed. But Rainsoul also contains what we call the derivables, which actually serve as a kind of a sugar that is not dangerous for the body, and also as a preservative for these seeds. So when you're thinking of these products, you know that, because I remember sometimes someone asks what preservative did we use for the product? That definitely is not natural. The preservative we use is inside the derivables, and so it is 100% a natural product. So they discovered this particular seeds, and they cold pressed them to bring out the nutrients in them. Now, cold pressing, let me try and explain something about cold press. You know, when 2 machines, let me say iron, are rubbing each other, they produce heat. So all these machines that will be used to press this seed or to break them in order for us to take out the nutrients in them will definitely produce heat. When heat is applied on anything, we all know what comes out of it is a deformation. For example, if you take an egg and you put it in heat, what will happen? It will boil. When you break that egg, you won't get that liquid that is inside it again, but you will get solid form of it. So it will change the state, it will change the shape, and it will change the, let me use the word, quality of the nutrient inside that particular thing. So when they want to cold press, what they do is to apply cold highs at -°C on the machines, so that heat will not be produced, because it is the heat that can deform. I'm trying to use words that we will understand easily. It is the heat that will deform the nutrients inside the seeds. So when it is under cold, when there is cold press, the nutrients comes out natural, has God has created them, 100% natural. So our products, all our products are cold press, and Reproductive is one of them. Like I said, Reproductive is our flagship product, and it contains these 4 things: the black cumin seed, the black raspberry seed, and the grape seed, and also the D-ribose. And Reproductive is very, very good. It is an antioxidant and also an anti-inflammatory agent, and also an immune booster. If you remember very well when I was talking the other time, I mentioned the fact that we need to boost our immune system if you want to prevent fibroid. So even if you discover that you don't have a fibroid and you are on this call today, I will advise you to be taking Reproductive, because Reproductive is a strong immune booster. It will boost your immune system. And when your immunity is high, your body will naturally on its own take care of any form of infection or disease that might be in it. So Reproductive is a very good product. It helps to reduce inflammation. Excuse me. I have had a lot of people that had arthritis that use just Reproductive. My mom is one of them. She used just Reproductive morning, afternoon, and night, and arthritis disappeared. So Reproductive is very, very good. And we actually need the antioxidant property as well, because I told you of free radicals and toxins. Excuse me. I told you of free radicals and toxins that comes into the body through the fibroid, and even some other things might cause these free radicals and toxins in the body. So because Reproductive also has an antioxidant property, it will also oxidize your body, it will clean your body. So Reproductive has also anti-inflammatory property. And one of the things that fibroid also causes inflammation. So, and that is, it is the inflammation that gives the pain. It is the inflammation that gives the pain, especially when the fibroid is expanding. When it is expanding and it is pressing on the wall of the uterus, then it will get the walls of the uterus inflamed. And once it is inflamed, inflammation will 100% bring pain. So Reproductive is a #1 product for fibroid, and it's also nutritional. It's highly nutritional. So because a lot of people that have fibroid, they find it difficult to eat one, because you know the tummy is bloated. The tummy is big, it's bloated. So when they eat, there's no space for that food to stay. So Reproductive is a very good nutrition. So when they take it, nutrition-wise, they will be good. Now, the second product is called Raincore. Raincore is our second product, and it is full of greens, and in one sachet, all the greens you will ever need, they are all put inside just one sachet or 1 ounce, depending on what you want to call it. You will need to fill your kitchen with a lot of greens. You know, the beauty of this product is this. What these products give you, if you say, I can just go to the market and buy all these vegetables and buy the seeds and sit down and start eating it. The quantity you will need to eat to get what is in our products, Reproductive and Raincore, is cumbersome. You will not even be able to do it. Imagine you said, okay, I want to use seeds. I know they've told us that Rain International is using seeds, and so I can just be buying those seeds to eat. And you went to the market, you buy the black cumin seed. I don't know if you've ever taken black cumin seed before. It has a pungent taste, and that taste is not friendly at all. I can assure you of that, because I've taken it on several occasions. And you buy black seed, you buy grape seed, and you buy everything. You will need to take big bowls of them. Imagine you having a big bowl filled with black cumin seed. Normally, if you eat half a teaspoon of black cumin seed for a long time, you'll be drinking water and drinking water and drinking water. But when you take soul, it's not like that. In fact, you will lick your tongue because it tastes so nice and the odor is so friendly. So raincore is our second product, like I said, and it is full of greens. So you can imagine you having a lot of vegetables all over your table, and you have to eat them raw, those vegetables. Especially if you're in Nigeria, I'm sure you will have a big problem because we don't eat our vegetables raw. We do cook it. We cook them a little bit before we eat it. So you can imagine. So, but Rain International has made it so easy for you because they have cold pressed all of these seeds and all of these greens, and they put them in this sachet or pouches. So raincore is full of greens and also has some seeds. So core is a detoxifier. It detoxifies your body, cleans your body of any form of impurities, germs, toxins, free radicals that might be there that might eventually come together to form major infections or problems in the future, like cancer and all those things. Raincore is extremely very good to clear this. And from this diagram, I'm showing you, you can see all the ingredients that raincore contains. It has aloe vera, it has the black cumin seed oil, it has the oil in it, and it has kale, it has chandonary black seed, and several others that are all inside raincore, our strong antioxidant. It is extremely strong antioxidant. It has more antioxidative property than any of the rain products. So it is extremely needful when we are treating cases like fibroids. And you can hear from my two sisters that shared a testimony. Both of them mentioned the fact that they actually used Rain Soul and raincore. So these two products are very, very good, and they will help you a lot. And also, you know, there are a lot of myths that people have said about fibroid. We need to be very careful about myths. They say a lot of things that are actually not totally true. And one of it is that fibroids are cancerous growth in the uterus. I think that's the first thing I actually handled when I was trying to define fibroids for you. And also that hysterectomy is the only effective treatment of uterus fibroids. No, no. Can you those my sisters that spoke to you, definitely they still have their uterus. Even when it has to be through surgery, it is not all the uterus that are removed. And also if you have fibroids, you can't get pregnant or stay pregnant. I mentioned something about pregnancy and fibroids, that both of them can be together in the womb. The baby is growing and the fibroid is growing. And the only thing that will be done is to monitor such a woman, just to be very sure that the fibroid is not pressing on the child. And if that is happening, there might be need for them to operate the woman once the baby is close to term, to bring out the baby so that there will be a successful delivery of both mother and child. So also that fibroids only affect women in their 30s and 40s. No, like I told us, the reproductive age varies depending on individuals. I told you of a 9-year-old that was menstruating. So not just those in the 30s and 40s. Once puberty is attained, it is possible for that woman to have a fibroid. And also that once fibroids are removed, they can't come back. they can come back. You had my sisters also saying it. I've seen a lot of people, I've treated a lot of people who removed fibroid and they came back again. So, and you can imagine if you are now using the Ray products, definitely they can come back because the products are antioxidants, they are anti-inflammatory, and they boost your immune system, that making your body to fight whatsoever infection or disease or problem. You see, one thing I love about the immune system is that the moment your body is going out of what God has created it to be, the immune system are awakened and they rise up and they fight like soldiers. That's what I call them, the soldiers of the body. So if you have fibroids, you will have heavy menstrual bleeding and pain. I told you some people has fibroids and they don't even know they have it. They don't know, because I also told you that some people don't have symptoms and they have fibroids. So you can't just believe this and say, since I'm not having all those symptoms you mentioned, I'm not having, so I don't have a fibroid. It might not be totally true. And that if fibroids are untreated, they will continue to grow. Fibroids grow whether they are treated or not. I said that before. So they can grow, even if you don't treat them, they can grow. If you treat them, they can grow back. It's possible. And that fibroid must be removed. I told you the other time that there are some fibroids that are like seedlings, minute, almost insignificant. So when you have such, you don't have to remove it. But when you have like that fundal one that I showed you that is so huge, that is pressing on the uterus, they have to be removed. And also that taking medications can make fibroids disappear. Medications may not make fibroids to disappear. I can assure you, Rain products will make fibroids to disappear. And that fibroids disappear after menopause. No, they don't disappear after menopause. If a person has fibroid, until they are well taken care of, they stay there. They don't go. But when they are well taken care of, they do. And now I want to believe that one way or the other, you must have gained something today. If whether you have fibroid or you don't have fibroid, you must have gained something. And you must have a note by now. So I would love to say thank you very much to my BRD, my wonderful partner, early morning exercise. Thank you for this great opportunity to share these tips with the people. Thank you so much.
Thank you so much. Thank you, ma'am, for an incredible session tonight. The feedback has been amazing. A lot of people had very, very positive things to say about it. And can I just add that we have a promo going on those two products that Pharmacist Olugbenga spoke about. You can, if you order those products between today and Tuesday, you're going to get them 20% off. We have a 20% discount going on in Nigeria and Ghana only. I need to stress that. The promo is going on in Nigeria and Ghana only. So you get 20% discount on those two products that Pharmacist Wuraola Olugbenga spoke about, okay? So please go back to the person who invited you. Let them know you want to get those products and you want to benefit from the promo going on right now. All right. Do you want to take some questions, ma'am? Because some people have questions. You want to take questions?
No problem, ma'am.
Okay, let's say we take about 5. All right, we'll take about 5 questions and they have to be straight to the point. 5 straight to the point questions, because it's nearly 1.5 hours that we've been here today. If you have questions, please raise your hand. I can see 4 hands raised: Mercy, Oluwatoyin, Ronke, and David. Those are the 4 I can see. We need 1 more and that will be it. Just 5 questions. So I'm going to start with Mercy. All right, 1, 2, 3, 4. I can see 6 out. All right, that's it. Oh, no. I'm stopping at 5. I'm taking the first 5, and that's it. So we start with Mercy. Mercy, kindly unmute yourself, ask your question straight to the point. Now, I need to stress that we are not doctors, pharmacists, that although she's a pharmacist, she cannot prescribe. All right. So I need to stress that. Okay, this is not a consultation. All right, Mercy.
Good evening, all. I hope you can hear me very clearly.
Yes, I can.
Yeah, I'm calling from Nigeria. Actually, I have not started. Okay, let me say I started using. Do I call it supplements or medication? I need to be sure what exactly I should call it.
What are you talking about? These products?
Yeah, rains.
Supplements.
They're supplements. They're not medication.
Yeah, supplements. Super.
Yes.
Okay, my brother wife gave me some of it to take. I don't want to comment yet on how effective it is or not, but the reason why I actually wanted to take it was because, okay, you're passing through menopause, your body is going through a lot of changes. Sometimes you don't even understand yourself. I've been going through that for the past 5 to 6 years. Hot flushes, all kinds of things. Sometimes I'm just feeling like the feelings are really very weird. I can't place it. And recently I started having this situation whereby I feel like I'm having difficulty swallowing. Not that I'm not having pains in my throat, but it's like even water, it's finding it difficult to go. It's a feeling that goes sometime, and sometimes it's right there. It can be very uncomfortable. Now I'm scared because you're saying that the pharmacist cannot give me a recommendation or how. So I want to start using the products. I've had a friend who is into this products for some years now. He's actually told me about it. He lives in UK. And when my brother wife started telling me about it, I'm like, no. I've got somebody who told me about this. I want to start using it. With the kind of feelings I'm having, I need someone to really tell me, what can I take? How can I take them? This is very, very important to me. This is an unfamiliar environment. I just want to be sure, because I've had a lot of things that the pharmacist has said that sometimes we take these things wrongly and then we say, oh, they are not working fine.
Right. So, Pharmacist Wuraola, I'm going to pass this on to you in a bit, but let me just say something. One thing you mentioned that I just want to touch on is because of the menopause, there's a lot of hormonal imbalance going on. The best product that would help with that is called Bend. It's Rain Bend. Unfortunately, we don't have it in Nigeria at the moment. We're expecting some in very soon. That will be my suggestion for the hormonal, because we've seen a lot of people that are going through menopause and they have the same symptoms you just described, and just using Bend has helped them with the menopausal symptoms. No more hot flushes, no more mood swings, no more, things have just normalized because Bend helps with that. In the absence of Bend, though, I would still suggest that you use Sol and Core. That would be my suggestion. But Pharmacist Wuraola, do you want to add anything to that?
Yeah, you've just said it all, Ma. Because the major problem she's having is hormonal imbalance. And once you have something to put that in place, you find out that your body will start functioning very well again. Even the swallowing aspect that you are talking about is still an hormonal imbalance case because of gas that is being built up in your tummy. And like I said, once there is gas, it's like a vacuum. Before you can put something inside a thing, vacuum has to be created, but the vacuum has been filled. So how will you be able to put something inside? So until your body reduces it before you now find it easy to take something inside. And I will still go with what BRD has said. Sol and Core will be very, very good for you.
Would you suggest how to use it? Should she use because, you know, before I used to say to people, use Sol first in the morning, core lasting at night. But since I started taking Sol lasting at night, I sleep like a baby. So I don't know even if we should say Sol in the morning, core at night. What would you suggest for her?
Like I used to tell virtually everybody I give core to, I tell them to take core in the morning.
Wow.
And Sol at night.
Oh, wow. Really?
Sol is much better at night.
Wow.
Because it relaxes the muscle. It has more anti-inflammatory property than core.
Right.
So core is very good in the morning because it's an antioxidant. And you know it is in the morning that you actually go outside.
Yes. That
you can gather all sorts of things into your system. So once you have core in your body system, your body will not take up those toxins. So core in the morning, Sol at night.
All right. Thank you so much, ma'am. All right, Oluwatoyin, straight to your question, please. Sharp to the question. Over to you.
Hello.
Hello, ma'am. Go ahead. We can hear you.
Hello, ma'am.
Please, as a follow-up to this about menopause and the hormonal imbalance, now I get it that the RC should be in the morning, RS at night. But the thing is, I may not be using it rightfully. How do I use in terms of how many sachet of the core or how many sachet of the Sol?
Is there a reason you are using it?
Yes, that's what I'm saying for menopause.
Okay, menopause as well.
Blurry eyes.
Okay.
Sore throats, catarrh, all those things, you know.
Right. Where do you live? Do you live in Nigeria?
Abuja, Nigeria, yes.
Okay. Because I'm thinking sore throat, catarrh, could that be hay fever or allergies? I don't know.
Similar to that, yes.
Yeah. Okay. Mrs. Olugbenga, over to you, ma'am.
We'll still go with the core and Sol. You know, Bend is an extremely good product, but I know by the time we have it back in Nigeria, it's going to help a lot of people. Now, ma'am, I will advise that you take the core in the morning, and core is much better on empty stomach, first thing in the morning. If you feel you are not so comfortable with it, you might just take a little bit of water, and then you take your core in the morning, and then you take your Sol at night. When you are starting off, it is better to use 2 core and 2 Sol, at least for the first 1 week. And after that, you can make it 1-1. And you will definitely see a lot of great changes, ma'am.
Okay, thank you so much. Diamond Ronke Okafo. Your hand is raised.
Yeah. Good evening, and thank you for that detailed explanation. Yeah, I want to ask this question about an uterus filled with fibroids and an 11-centimeter ovarian cyst. She said, what are chances of getting better? That he would really like to hear people's experience too. The point is, she's like a kid sister. She's supposed to be on this call, but unfortunately, where she is, she cannot be on Zoom. She's in a meeting right now. So I'm asking this question on her behalf.
I didn't get your question very well.
She has multiple fibroids
in
her uterus. Her uterus is filled with multiple fibroids. And she has an 11-centimeter ovarian cyst. What will you recommend?
Cyst is like the junior sister of fibroid. So, but they will still be treated the same way. I will advise that because she has multiple is better she use 2 of the 2. 2 core in the morning, 2 Sol at night. And she should be consistent with it. You understand? Because a lot of people will just use it and then drop it. If she can do a first month that way, it will be very, very good. She will get great results with it.
Thank you so much. I appreciate it.
You're welcome, ma'am.
Awesome. Okay, let's go to David Adefolaju. I think you're probably number 5.
Thank you very much for this wonderful presentation. I want to be sure I got you right. Your last statement, Are you saying that it could only be surgically removed, after which you can use a product? Or can a product melt them? I want to be sure.
Okay.
No, I didn't say it has to be surgically removed before you use the product. There are several people that use only our product and they got excellent results. There are some people that had surgery and the thing grew back. They now use our product and they had results.
Thank you very much.
Surgery is your choice.
All right.
Yes, sir.
Thank you.
You're welcome, sir.
Okay, Modukwala Mustafa.
Good evening, Mas. Thank you very much. Yes, thank you very much. Yes, ma'am. See, I have somebody, precisely my sister, my elder sister. She has a cholesterol for a very long time. She has been going to the hospital, the cardiologist that is attending to her. Doesn't want to put her on conventional medicine. She has gone through a lot of processes with the hospital or whatever. So when that happened, now I placed her on call and resto. She used them for 3 months. She started with a 2 call per month, one in the morning, one at night for 2 months. Then second month, I started her on a call and resto in the morning, call at night. So she went for test on Friday. Yesterday, she saw the results. So she didn't call me. I just called her today. She said, that's why she didn't call me. That is still at the same level. It didn't come down. I said, did it go up? She said, no, it didn't go up. So she says she's waiting for a cardiologist now. And second one, ma, I have somebody that has been stooling excreta with blood for the past.
You said she had high cholesterol.
Yes, ma. Yes, ma. Can I just quickly say
let me answer that one first, ma.
Yes, ma.
Yeah. Why she was using the core and the stool, did she adjust her diet? Because you see, it's not just using it. Like when I was presenting, I mentioned the fact that there are several things that need to be adjusted. Exercise and several other things that need to be core and so. You know, the thing did not increase because she was using core and so. Definitely there is something that keeps bringing in the cholesterol that she's still doing. She needs to check her diet. You can go on with the second one now, ma'am. Hello, ma'am.
Okay, ma. Yes, ma. Yes, ma. She's actually really watching her diet, honestly. They have placed her on special diet and she's really abiding by it, ma. I don't know. So do I continue with the second one, ma?
Continue, ma.
Okay, ma. So the second one, this person has been passing excreta with blood for the past 25 years. So when he approached me, I started him on soap. So when he finished a packet of soap, he said he didn't see any changes. So I placed him on call again. He has not seen any changes, ma. Thank you, ma.
What is wrong with the second person?
Stooling, passing excreta with blood.
Oh, okay.
For 25 years?
Yes.
And that is hemorrhoid.
He said he doesn't have hemorrhoid.
Then why is blood coming? I think he needs to go for proper examination.
Yeah.
Don't let us just use head knowledge.
Yeah.
There is need to actually examine the source of the blood, where the blood is actually coming from. There's need to check. We should not just assume everything is okay. You know, I mentioned something the other time that a lot of people will just they will be bleeding. You don't know. It might be fibroid, it might not be fibroid, it might be from any other source. So let him go for proper checkup. Thank you.
Okay, ma. Okay, ma. Please, what do you advise I tell my sister now?
Your sister case, I still believe there is something that is keeping the cholesterol. If it is not increasing, then core and soul they have played their part. Okay. If I don't want to start medicine listen here, man. I don't want to start prescribing. So let's keep it that she might just increase the core and soul.
Okay,
So instead of using 1-1, let her increase it. Let's see how it will go.
And also,
Okay.
there's a suggestion. How about she changing from soul to soul red? Soul red is a bit stronger.
So red, okay.
It's
That's another
so red.
one.
I'm giving her so red, ma. I've
Okay,
been giving
soul
her
red.
so red.
Okay.
Yes.
Okay, she was using so red before.
Yes.
Okay, let me
ma,
change to
yes.
soul.
Then let
Okay.
her change.
I think you should change to soul. See soul. Just how use soul and core.
Okay.
Somebody is asking, for how long has she been using soul red and core?
Everything 3 months, ma. She used core for a month and so core and red for 2 months.
Okay. All right. Okay. Let's change to soul and see. Let's
Okay,
see.
ma. 2 core, 2 soap per day.
Yes.
Okay.
Okay.
All right.
Thank you very much, ma.
You're
Soul red
welcome.
is, I'm seeing what our sister Kesha is saying. Soul red is very strong. Oh. That thing is very strong, man. Soul red is quite stronger than normal soul. Okay, all right. Let's go to Ade. Ade, kindly unmute yourself. Straight to the point, please.
Hello, good evening, everyone.
Good evening, ma'am.
Good evening. Thank you for your answer, for everything. My question is, I actually bought this product because of a diabetic retinopathy. I've started using Co since the 19th of this month, and I've not seen any different. I have bad vision. I'm not seeing very well. It's still there. I've already bought 2 packs of core, and now I've bought red again to add to it. Apart from diabetic retinopathy, I always have pain in the chest, a serious one. Since I started using the product, I've not seen any difference either. That's another. In fact, I feel like stopping the product because I've not seen any difference in the pain in the chest. There's another one that I've been experiencing for more than 10 years now, pain in the throat. When I went for scanning, they said there's something like break in the cartilage, on my throat. The pain is always there too. I want to know what is the problem, because I've been hearing people's testimonies that when they start using the product for just 1 day, 2 days, 1 piece and all of that, they see difference. Why is it not working for me right now? I want to know, is it that something is wrong somewhere? Please, I would appreciate if you can explain for that, especially on the diabetic retinopathy. Thank you very much. That's my question.
Sorry, can I ask you quickly, how long have you used the products for?
I started 9th of this month.
Oh, it's not even up to a month.
It is not up to a month, but the testimonies I've been hearing is like they use it for 1 day.
No. Sorry, hold on a minute. The lady, sorry, no. The lady that shared the testimonial on fibroids, she used it for months, right? Immediately she used it, the pain in her abdomen left immediately. She was able to sleep better. The bleeding stopped. She continued to use it. The bleeding came back, but she still continued to use it. She used it for months. And now she's been using it for over 2 years. She's still using it right now.
Yes,
so
I don't have any intention of stopping it, but at least for that, like 3 weeks now, I should be able to see something, especially on the pain issue, on the body pain, the chest pain and stomach pain. If we are not even talking about diabetic retinopathy now, that one might not be as fast, I think. What about the pain?
You see, one of the things I learned, and I'm going to let pharmacist Olugbenga speak about this, but one of the things I learned when it comes to supplements is that they're not drugs. They're not drugs. It's like you're eating food. It's going to take time for your body to get everything it needs to feed the cells that would do the work. It's not overnight. It's not chemicals. It's food. It would take time. So what I've been told is, so I actually heard it once at a seminar I went for, the length of years you've had the condition for, the equivalent of that is what you should take in months.
Seriously?
Yeah. So if you've had the issue for 10 years, take these products for 10 months before you even start asking questions.
Okay.
That's what I heard. Yeah, that's what I was told. Because it's not automatic, it's not magic. It would take time. And also our bodies are different. The way you react to something is different from the way I react to something. Then our lifestyles will come into play as well. You know, maybe I drink a lot more water than you do. Maybe you still take fizzy drinks and I don't take. Maybe you drink coffee, I don't drink coffee. Maybe I go on walks, you don't go on walks. All of that would have an impact on it as well.
Okay,
But
like right now.
Sorry,
right now. Hello, are you there?
I'm
Can you hear me?
Pharmacist Olugbenga.
Right now, I'm on injection for the diabetic retinopathy. I hope it won't have any issue with your products, with your supplements.
You're doing what? Sorry.
I'm on injection. For the diabetic retinopathy. Yes, I'm taking injection for it. I hope the supplement won't have any issue with it. Should I still continue with the supplement while I'm taking the injection? Because like I was told that the injection will work for the eye. You know, just the same way you said that the core you work for the eye, that to stop the bad vision, that the injection is going to work for it. I hope it won't take any side effects with the injection.
It's like you're eating food, though. Will you stop eating food because you want to take injection? It's the same thing. You're eating, the products are all natural. There's no chemical in it. Nothing.
Okay.
It's just seeds. It's like you're going to eat apple and you chew the seeds.
Okay.
You understand? That is all natural. So it won't have any negative effect with anything else you're doing.
Okay.
And another thing, Ma, you mentioned that you are using core. So you are using core alone?
No, yes, for now alone, because I've already bought red. So I want to know if I can still be using the two together. You shouldn't have
used core alone.
Okay.
Yes, you shouldn't have used core alone.
That was what your marketer, recommended for me. You know, I'm not part of you people.
Marketer, everybody is independent.
No, even on the program too, I heard that we should start. In fact, somebody told me to stop using red for now, that I should clear my toxins, whatever, first before I start using another product. So I stopped. So right now I'm using only the core. Okay. I have red already with me that I've bought.
Okay. So how long have you used for 3 months? 3 weeks?
Yeah, 3 weeks.
Okay.
You bought red now, have you?
Yes, I have red with me.
I would advise that you use them together. Okay. It works. It will be more. You know, I said something that core is purely antioxidant. Okay. It's like, how will I explain this now? Let's say core has 80% antioxidative property, and the remaining 20% is the anti-inflammatory and immune boosting property. Now, soul has 80% immune boosting property and 10% antioxidant and 10% anti-inflammatory. I'm not saying that is how it is. I'm just giving you a scenario. So you actually need your immune system to be strong, because you see, these supplements are not the one taking care of whatsoever is wrong with you. It is your body that is doing the work. But the supplement is activating your body and awakening all the natural things that God has done in your body to come to work and do what they are supposed to do. So you need the immune system to be very, very strong. And that's one of the major prevention, the number one prevention I even mentioned, that we must have a strong immune system. So definitely by the time you start using the two together, you see great difference. And like BRD has said, one, our body differs. The way each person responds to treatment differs. And then number two, these things are food and they take their time to work on your body. And like she said, how long you've had it determines how long you might need to use it to have effective results as you want. Thank you, ma'am.
I'm more concerned about the diabetic retinopathy. Is there any hope, or should I rely on the product that is going to work even after taking it for a long time?
The product will definitely work. We don't talk about cure. Do you understand me? But the product will definitely work.
Okay. So how should I use it now? Red in the morning, call in the morning and red in the night.
How have you been using the core before?
I told you I stopped red because somebody said I should use the core first for like 3 weeks or 1 month. Then that is when I can start using the red.
How many?
So I stopped. I started on the 9th of this month.
How many are you using?
1 in the morning, 1 in the night.
It's okay, but you can increase it. You can make them 2-2. Watch the way your body will respond to it for 3 to 7 days. Okay. Then you know how to go.
That means it's 4 per day, 2 in the morning, 2 in the night.
Yes, 2 core in the morning and 2 soul at night. And then watch the way your body will respond to it.
Okay.
Because at times there is need to have a high level of the ingredients of the supplement in the body system for the body to respond. Some people, until the level is very high, and we do this in medication as well. You notice that some medications will tell you take 2 to start, then change it to 1-1-1. This is because we want to have a high dose of that medication in your body, because definitely it has what we call half-life, and it's going to break down itself later.
Okay. Thank you very much.
You're welcome.
Thank you so much. I appreciate.
You're welcome. You're welcome.
Drink a lot of water. It takes time.
Is BRG there?
Oh, sorry, I'm here. I've been talking. Oh, can you imagine? You people, I muted myself. All right. We're just taking the 3 people raising their hands now. Agada Grace, over to you. And then Omawumi, and then Core. That's it. Agada Grace, straight to the point, though, please. What's your question? Go ahead. Unmute yourself, please. Agada Grace. All right, let's move on to Omawumi. Unmute yourself, please.
Hello, good evening. Good evening. Good evening. My name is Omawumi. I just have a few questions.
Good evening.
The pharmacist had mentioned that no hot water bottle when you have a heavy flow. So I just wanted to understand why. And okay, can you hear me now? Can you hear me now?
I'll repeat it.
Because it's breaking.
I'll repeat it for you, Mr. Olugbenga.
Okay, so that's my first question. Did you hear my first question, please?
Ms. Olugbenga, can you hear me?
Yes, I can hear you.
All right, she's saying that she wants to understand why you said not to use hot water for your menstrual cramps.
If you have, she said,
they should not use hot water.
I'm sorry, ma. She said no hot water bottle if you have heavy flow. So I just wanted to understand that.
You said no hot water bottle if you have heavy flow. Is that what you said?
I didn't say that.
Oh, okay.
What I said is that
in the text of the presentation, there was no heat if you have heavy flow in brackets.
No, I said you can apply heat. That was what I said. And I mentioned hot water bottle, that will help you to apply heat.
Okay.
That was what I said. I said you should apply, because when you have cramps and pain, you actually need heat to help you. But I mentioned no heat when I was talking about cold press, that the seats were cold press, and so heat, they don't need heat because the heat will destroy the ingredients in the seed. That was when I mentioned that no heat, not with cramps.
Okay, so even if I have heavy flow, it's okay to still use the hot water bottle?
Yes, It is.
Okay. Awesome. Okay. So I also thank you so much for that. I also wanted to ask, because I'm hearing, because I have fibroids, right? Multiple. So right now I'm taking Soul I was taking Core. I did Core for 2 weeks. And then now I've switched to Soul and Bend. I did that for 1 week, and then now I'm doing Soul in the morning. So 1 Soul in the morning, 1 Soul in the evening. But now I'm hearing 2 Soul in the morning, 2 Soul in the evening, or 5 Souls per day. So I'm really not sure which one to go with. Just wanted to clarify.
You see, when you have multiple, for example, when you have multiple, there is need to increase. We don't use the word dose, but that's the only word that comes to my head now, maybe because so there is need to increase the quantity you are taking in order, like I've said, to have a level of the ingredients in your body system. So when you have a high level of the ingredients in your body system, then it will be maintained, okay? And then gradually you can reduce it as you are getting results. So actually with multiple, using one may not quickly give you the desired effect. So there is need to increase it.
Right, okay, Omawumi, is that all? Did you get that? You can unmute again. Omawumi.
Yes, I wanted to ask what I should increase it to.
Okay.
What I should increase it to, yes. What should I increase it to, ma'am?
Are you bleeding heavily, ma'am?
Only during my period, and then I spot
Are you bleeding?
Every now and then. Yes, I am. Yes, I am.
Is it only when your period comes, or
even after my period? Even after my period for weeks, I'm still bleeding, and then it stops, and then it starts, and then it stops, and then it starts.
Okay, if you can start off with 3 Core and 2 Soul consistently.
Okay, because I did Core
for like 2 weeks.
I did Core for 2 weeks.
But you are doing
and then I was doing one during the day, one at night. 1 Core in the day, 1 at night. So I did that for 2 weeks.
It's better first thing in the morning before food on empty stomach. If your body, if you don't have ulcer.
No, I don't have ulcer.
Okay. If you don't have ulcer, it's better on empty stomach in the morning.
Okay, so now that I've done
last thing at night.
So now that I've done Core already for 2 weeks, 1 in the morning, 1 in the evening, what should I do now? Then I turn to Soul.
You will still need
1
Core.
Soul in the morning and Bend in the evening. But now I've been taking 1 Soul in the morning, 1 Soul in the evening. So that's what I've done so far.
Man, you still need Core and you still need Bend. Let's do it like this. Since you can get Bend, then you can make them the 3 of them, be using the 3 of them. You can use your Core in the morning, your Bend in the afternoon, and your Soul at night.
Okay.
1-1-1.
1-1-1.
Yes, I want to believe you will have a good result with that.
Awesome. Okay. Thank you, ma. Then I wanted to ask one last question, please, ma. How many calories does each tube have? How many calories does each serving have? Of Soul or Bend or Core, just in case for dieting sake, because I'm going on a diet, so I don't know if it's going to affect my calorie count.
I don't think you should worry about the calories in this product.
But I don't know.
Sorry,
I don't know if BRD knows that offhand.
Yes, ma'am.
I don't think you should worry about the calorie count of these products.
Okay.
Yeah, I don't know how many there are in each sachet. It's something we can find out. Probably need to reach the head office for that, because it's not something we put on the products. Okay. But after having said that, you can actually remove food and take this instead. Do you understand what I'm trying to say? So yes, because it's weight, right? That's what, yeah. So I'd rather you took these products and not eat than try to reduce this product to fit in your calorie count.
Oh, okay. Because I was going on a Cambridge diet, and usually when you go Cambridge diet, you don't take anything. So I was wondering how I was going to add to my count.
Cambridge diet is a serious one. It works, but it's so that you're going to is a VLCD, 800 calories a day, right? Is that what you're doing?
Yes, ma. Yes, ma.
Ouch.
Yes.
Well, I would say you should. I would say, if you're gonna take out anything, don't take out these products. That's how I put it.
Okay.
Yeah.
Okay. Thank you.
You're welcome. All right. We have one more hand raised. Core. Core is the name of the person. Core. Hello.
Good evening. Hi, good evening. My question is, how do I take it for endometriosis if there's also a cyst in one of the ovaries? How do I take both soul and core?
It's still the same way with what we've been saying. You take the core in the morning and the soul at night. If you can, start off with 2 core, 2 soul, and later on it will come to 1-1. And maintain 1 core in the morning, 1 soul at night.
Okay, core, I hope that is okay. Because you muted yourself again. 1 second. Core, does that answer your question?
Yes, it does. But I also want to find out if you have ulcer, does that affect it anyway?
Yeah, you need to take it after food. If you have ulcer, take the product after food, not before.
Okay.
All right. Okay, that's it. Everyone. Hello.
Yeah, so will that help remove the cyst in the ovary and deal with the endometriosis completely?
Okay, pharmacist, I'm going to pass that to you.
Yes, it should.
Did you hear that?
Yeah, okay, I heard that. Thank you so much.
You're welcome.
So people have private messaged me. The calorie information is in the, well, they say it's in the fact sheets. Fact sheets. So what I'm going to suggest is, Omoumi, go back to the person who invited you and ask them that question about the calories, because they can bring up the fact sheet and share that with you. Oh, all right. Another person is, why are you all private messaging me? Put it on the chat. Put it on the chat so everybody can see. Sachet calorie averages between 15 to 20 calories. Okay, there you have it, Omoumi. Between 15 to 20 calories per sachet. That's what I'm being told here. Okay, between 15 to 20. Well, I don't know. That's what I'm being told. But I'll still say you go back to the person who invited you and let them check on the fact sheet, because it'll be there. That way you can have the accurate figure for the products you are on. All right, ladies and gentlemen, it's been, oh, okay, somebody else has posted it. Soul is 35, core is 15. Wow. But Ms. Olani, you said between 15 and 20 calories. You see that? Soul is 35 and core is 15. Okay. All right. I don't know. Still go back to the person who invited you. Let them check. Ladies and gentlemen, we've been here for over 2 hours. I'm exhausted. Thank you so much for coming on tonight, Pharmacist Olugbenga. We truly, deeply appreciate you for taking us
through the
session tonight and explaining all of this to us and for us, and just helping us have a better understanding of the women reproductive health and also how to help ourselves through nature. Thank you so much. And to all that showed up tonight, we appreciate you. Thank you for sitting for like 2 hours for this session. We appreciate you. And we look forward to seeing you the next time we invite you for another health talk. And believe me, we're going to have another one. All right. Thank you so much. Have a good evening. Good night. God bless you. And have an incredibly amazing week starting tomorrow. God bless you. Bye for now. Good night, everybody. Thank you, ma.
Yes, ma'am.
God bless. Thank you so much.